So like Connie said, we have a very long name. We are Williamson County and City's Health District, but essentially all that means is we are your local health department. We've been around since the 40s, providing a variety of services to residents and folks who travel through our county. And we have locations speckled all across the county. Our headquarters is in Round Rock, right up of I-35, a little bit behind the Kirby Lane. But we also have locations in Cedar Park, Taylor, and Georgetown. We also have a mobile clinic that goes out to Liberty Hill, and we're always looking at ways that we can potentially expand to serve as many residents as possible. We are governed by a board of health, so they are my bosses. I have 8 bosses and many more, which are all the residents of Williamson County, but they represent the cities listed here. And we like to brag about ourselves. We were one of the first public health departments to receive both accreditation and reaccreditation, and that means a lot of technical things, but the gist of it is that we always are taking community feedback, trying to be responsive to the needs in the community, and we're constantly in a state of quality improvement. So as you can see, we are responsive to the residents of Williamson County, and then from there we have our Board of Health, which is brought in by Commissioner's Court and also from different city managers from our member cities. On our executive leadership team, it's myself, a medical director who oversees our clinic work, and then a deputy director, and we split up all of the work that we do. And we do a wide variety of services, which I will go through in more detail, but it's all over the map. My job is not boring. I love that. I get bored very easily. And there's so much that we can do to support people from all walks of life, all income levels. So as our county is growing and shifting, we're doing our best to respond to what is really needed in this community. And we talked about that. All right, so a little bit about us. Right now we're sitting at 96 positions. Most of those are providing direct services, though there are a few of us who do the behind the scenes paperwork and desk work. Most of our funds come from the local governments that I talked about, so the major cities and Commissioner's Court. And we also have state funds, which is a mix of dollars coming down from the feds through the state and the state actually providing us with some dollars. We do have a small amount of revenue that we generate from mostly inspecting restaurants and having permits there, but we do have some fees that visitors, when they come and use our clinic services, if they can't afford to pay, they pay small fees for receiving vaccinations or different services that we have. And then there's a few other things that we use to fund ourselves. We had a little bit of money that we could invest, and so there's a small amount we use for our positions there. And then we also are pooling from our reserve right now. Public health goes through feast and famine times in terms of our funding, and so thankfully we have a decent sized reserves where when things are tough, we can pool from those funds. So y'all are probably aware whenever there are federal or state cuts, you may see some cuts locally. Thankfully, due to the planning that we've been doing for many years and knowing that we swing back and forth, we have not had to let go of any staff at this time, but any time a position is vacated, we ask, is this position still needed? Is this the best use of tax dollars? So unlike most of the local health departments in Texas, we really have not been impacted because we have that practice of always looking at what we're doing and making sure we're responsive to the needs in the community and using our dollars accordingly. So to walk through what we do, disease response has been most heavily, that's where the focus has been externally in looking at what we do. So those are our epidemiologists. They look at how disease travels through populations. Per state of Texas code and statute, we do have to try at least to investigate up to, it's almost 90 diseases at this point and disease syndromes if they are reported to us or to the state of a resident in our jurisdiction. So that's anything from potentially measles to a drowning of a child. We have to look into all of that and attempt to talk with providers, with patients or their parents. We also have a mosquito surveillance program, which I'll talk about in a little bit. And so we have one individual who's setting a lot of traps during the summer. And unfortunately, it's looking like it's going to be another busy summer for our mosquitoes. So not looking forward to that. We do have a clinical services team, so this is kind of your bread and butter public health. We have actually, these are the number of appointments. We've had a little over 3,500 vaccine appointments, so many more vaccines than that. We do provide well women and sexually transmitted infection visits. And then we do have a tuberculosis team made up of four individuals, 4 nurses, and we have seen our tuberculosis rates rising. This is a nationwide, actually worldwide concern, but we're seeing it locally as well. And so that team is staying very busy, responding to both active tuberculosis and tuberculosis that's more latent, which means it's in your body, it's not contagious, but it could rev up in the future. So we talked about mosquito surveillance. This is Jason. He's one of those people you will see at almost every outreach event. He loves talking about mosquitoes and bugs and scaring the many women in the office with all of his bug collections. He does an amazing job setting traps, looking at mosquitoes and making sure with the state that we don't have West Nile popping up in these traps and putting individuals at risk of contracting West Nile. We had a record season this last year of 75 of our traps that were set showed West Nile. We do not have a truck that goes around and sprays. What we do is we raise the alarm and our concerns to the different cities that we work with and to the county, and we provide our expertise, but it is up to them in accordance with what their residents want in determining whether they would like to spray or not. We also manage the indigent healthcare program for the county. This is a program that is required by state law for every county to provide, and we do that on the county's behalf. So this is for really the poorest of the poor. These are individuals typically who live out of their cars. They're at or below 21% of the federal poverty line. And this program essentially allows for them to have a small amount of funds to use for any medical emergencies that they may have. Yes, sir.
What insurance are you all using for that particular program?
So we don't use insurance. We work directly with providers, and we set, typically it's Medicaid rates that we offer to pay those providers for seeing these patients.
Okay, so you're different from what the Austin Central Health is?
Yes, that's correct.
Because what I'm seeing, so I know a lot about them.
Mm-hmm.
And in fact, I don't like what they're doing, to be honest with you. So far what I'm seeing is a good program, so thank you for that.
Of course, yes. So that's something that we do for the county. It's something it's been very interesting to watch over the years, because as this county is becoming wealthier, we're seeing with a lot of our standard programs that you think of that are eligibility based, that we have less and less people who are qualifying, but we see more and more people asking about this program. So what we're imagining and we are seeing is in our surrounding counties, they're actually seeing a lot of that growth and movement of folks who can no longer afford to live here, living in their communities and then accessing services there. So we do still have a large amount of participants using the program here, but we're not anticipating that number will continue to grow just because of the many barriers there can be to live here.
Do y'all work in conjunction with community partners such as Sacred Heart Community Clinic?
Yes, we do.
Wonderful.
Yes. Yes, so we, over the last, I think it was this last year and a half, we formed formal partnerships with them. We've been working very closely with Sacred Heart and Samaritan Health Ministries, but we set up a formal agreement where they can be providers and they actually can provide dental care that we would provide donations for as well. So that was one addition that we provided specifically for those groups, because we know that they already know that audience, they have the trust, and so we work very closely with them. They are. And another thing, the county was very generous and gave us some funds out of the American Rescue Act funds they received to start up a cancer prevention, screening, and for breast cancer, a treatment program for those who didn't already qualify for federal and state programming. So we started out with breast cancer, and we actually expanded out recently to do colon and prostate cancer screening. So we don't have large numbers there just yet, which The good thing with that is that means people are finding a way to receive services through the state and federal programs, but we're grateful that we can at least spread the word and try and connect people to services even if they don't qualify for ours. Our retail food program, people either love this or hate this, so we'll see how this goes. So we are the ones who inspect the restaurants here in this county. We have been working over the last 2 years to really ramp up our efforts here to make sure that every place that has a permit with us gets an inspection at least once a year. And we really focus a lot on education. We have what I consider to be a pretty generous policy compared to our surrounding counties of a 3 strikes and then you may be out type of situation where we'll come out the first time, provide education if we see things aren't going well. The second time we come out, they need to temporarily close just to take time to fix any issues that we found. And the third time, if there's still a failure, that's when they have an opportunity to appeal to keep their permit, but typically they're not able to continue functioning. Yes?
Are those inspections scheduled or are you surprised?
They are surprise inspections for the first round. Now, if we come out and they fail, then they have 10 days. We tell them we're coming out in about 10 days. We're not telling you what time of day, but we will be back to see whether you succeed. Hopefully at that point, since they know we're coming, they pass. And then after that point, it's a surprise again.
What if they deny you access?
So we have something called a retail food order, which essentially is like a local how-to of how we run things, right? And every business that gets a permit with us should be aware of this because we tell them about it all the time and they're sick of it. And they know they need to follow that order in order to stay operational. If they refuse entry, which does happen, people say, oh wait, I was gonna take a break, and they close everything down, or don't let us in, or try and block us. We can administer administrative fees. If there's people who flat out say, sure, try and shut us down, we're gonna keep operating, then we work very closely with the city legal teams, and the county is necessary, though it's only gotten to that point once or twice in the time I've been here, to try and persuade them to work with us. So thankfully, it's never had to progress to going to court or anything like that. We just try and work with our partners and again, take a very educational approach because all of us like to eat out. We just want to make sure that we don't get sick. Yes, ma'am.
I had a quick question. When I was in college, we used to have a guy on television on the news that was talking about this right here, and he would tell you about the reports.
Mm-hmm.
He'd be like, "Is this restaurant got closed down because they had slime?" Is that still a problem out there? Slime in the ice machine? Is that something y'all see in the world?
You'd be careful with ice machines. They seem to be like one of the bugs like them. They seem to be hard to clean compared to other things. So, yeah. So we definitely, over this past year, we put our inspection scores online, and then I know some of the newspapers also run the reports as well. Some people like that, some don't.
Get back in the good graces if you've been shut down.
So if it gets to the point where you're 3 strikes, you're out, and we do talk to businesses about this. Per Texas law, we can't keep a person from opening a business in our community, right? And so technically, anyone can turn around, start and say, I want to start a new business. But the thing is, they have to come right back to us and start the process again, work through a plan review process. And we already know they're going to need to fix these things before they can even get their permit and become operational. So we have to balance it, right? But they have to work with us no matter what route they choose. Yes, and it takes a while. If they haven't been compliant with us before, then we're keeping a close eye on them throughout the plan review process.
Nasty today, nasty tomorrow.
Yes, ma'am.
Do you all take care of both infant and child care and also the senior care centers? Or not?
Yes. Mm-hmm. And I will say, if we do find a situation, we've had a couple situations with long-term care facilities where things were not being done very well. but we recognize that individuals who are in those facilities need to eat and have very strict dietary restrictions. And so we work with those facilities to either cater food in if they need to shut down and work on what they need to do, or work with the overarching business to make sure that those individuals are fed.
I'm sorry, I have one more quick question. I know you got-
No, no.
I've been looking at the time before you got.
Oh, thank you, thank you.
I do a lot, I'm a photographer, I do a lot of food photography.
Oh, nice.
I sell like nasty stuff. Should I be reporting this?
So we do have, yeah. So, yeah, for us, we're trying to keep everyone safe and everyone healthy, right? We don't need you to be a narc, right? But we do have a complaint page. So we've had situations where somebody sees a rat run through a restaurant or roaches, and then they can give us a call or they can report on our website, and we make sure that we go out. We try to make it out within 48 hours with our team. So
Put your name on that report?
no, you do not.
Yeah, I know.
Yes. And then the program that brings through the most amount of residents through our facilities is our Women, Infant, and Children program. Quite a few people are familiar with this. Staggering stat, more than 50% of the babies born currently in the US are eligible for the WIC program. You have to be at or below 185% of the federal poverty line for that. The benefit for us, I mean, we get to see so many families to connect them with other services. We have seen quite an increase in the number of patients that are coming through. So we never know. Sometimes that's a sign of how things are going economically, but we never know. Sometimes in the summer things slow down. There's a lot of factors that impact our WIC program. And then, yes, like Connie said, we do have a volunteer program. It's the Medical Reserve Corps. It's a bit of a misnomer. You do not need to have a medical background to be part of this program. During times of emergency, so like during COVID, we used these volunteers a lot to help us with the flow of our points of distribution. We also, during routine times, we use the volunteers for anything that we might need, so outreach and just helping in the community and getting the word out. There's a picture here of our team going out, some volunteers and our volunteer coordinator. When we had the tornado that hit Round Rock, our volunteers went out during recovery time to see if they could offer water, offer support, and just see if we could connect anybody with services that we had. So really just a good way to be connected with the community through that program. And then I think this is one of so that I can leave my card. It's online, but our website, there's so many ways to get to it. So I think probably the best way is connecting with somebody at the health district and calling our main line, and they can make sure that you're connected with them. I think this is one of my last slides. We do also have a coalition called the Healthy Williamson County Coalition, and we host a variety of meetings. We just had a meeting yesterday on looking at suicide data for the county. So we talk about mental health, as that's an area that county residents have been very concerned with for more than the past decade, chronic disease, general well-being, and it's a way to help give your voice back to different agencies and partners in the community who can actually do something to improve the health in the community. So we have a community health assessment that's published every 3 years, and an improvement plan that we work on with the members of the coalition every 3 years. And then any questions? All right, thank y'all so much.
Thank you so much.